Okay, Assalamu alaikum, sisters. So, like I said, we are going to go over how the pioneers in homeopathy have suggested to deal with severe and acute pains. Of course, the basic idea of this homeopathic class is for educational purposes only. And please consult the right health professional in the right time and get your information from there. So, so let's start. Who is Sister Abdul Hafiz? Okay, somebody new.
Assalamu alaikum, sister. This is
Oh,
Neona.
Sana. Okay, okay. Yeah, yeah, you guys have names. Okay. So let's start with Sister. Oh, wait, let me see. Let me share my screen. What? Okay, I cannot, she said I cannot minimize. Okay. So let me share my screen and let me show you. Okay, so I looked up these two magazine and I was making a lot of charts and these charts, and like I told you, I was telling my story that this one book was 313 megabytes. It's a homeopathic memorizer, almost 100 and more than 100 years old book. And if you're asking me where I got that from, I have subscribed to a site where subscribing with money, not a lot, but it's worth it. So there are books uploaded which I can download and I can read them. So these are the books from online sites, but these are the valid books. So like Sister Umama, she always asks me so that I need to talk about the levels of health. So we all know there are how many levels of health. Now, according where I'm just bringing this information about the levels of health is from my professor Vitarkas. Okay, so he is the one who talks about the levels of health, and uh, there are 12 levels of health, and in how many groups? There are four groups, okay? There are four groups, and there are 12 levels of health. Where did I put it? Okay, maybe I have it over here. I did not make a PowerPoint today because I was making a lot of, uh, no, I was making a lot of these level of health. Where is my levels of health? I have made already an emoji chart for this levels of health. Okay. Uh, that happens when you do too much. Okay. So I'll show you in a minute. So first, I'll show you there are 12 levels of health in four groups. The best one, the people who are in the best level of health, I will bring that up, are in group A. Then our group B. So each has three levels. The first three in group A, the next three in group B, the third three in group C, and the fourth three in go to participant, click on your name. Sister, you can rename. Oh, you don't have, that's up to you. That's up to you. Okay, so before that, let me tell you about the cell salts, right? Cell salts are very extremely important. And I call her the queen of cell salts, maybe not so. But they're Schussler cell salts. Schussler was again a pathologist, a doctor, a homeopath who researched on these 12 cell salts. That's why they are named after him. And why are they important, sisters? They are very useful in minor ailments. Minor ailments means minor problems, day to day life. And he used them as treatment, but we can also use them as a long term follow up, small Schussler salts like vitamins, minerals, replacements, and they're very very effective when they're potentized, but when we are using in 6x, they are They can be used with other homeopathic remedies, as been said by the masters. It's not me, it's the masters. They have said that they do not interact, because I am a classical homeopath, which means I use one remedy at one time, and I do not combine remedies, because the effect of the remedies are not clear. They are proven as individual remedies. Okay, anyone has a question? No? Okay, so these are the 12 Schussler salts. These are the 12. I have sent you this document also. They can be used 3 to 4 times a day, or they for the treatment, or they can be used one time a day. And we talked about calcarea floor. I mean, the ladies who are menopausal, postmenopausal, calcium and fluoride are very, very useful, and especially who have bone and teeth issues. They have some of us have veins, varicose veins issues. So it's extremely useful. Calcarea floor 6x. Okay, you can buy them online. I buy them. We can buy them on eBay or on Amazon, and I can give you more info while it's very easily, you can buy them very, very easily. Calcarea floor is extremely useful for varicose veins, especially. But how long do you use it when you're using 6x? Please use it at least for 2 months to see the effect. It does have a effect, okay? But you will not see it one day, 1 week, or 2 weeks, but it will give you the results. And also for the loose teeth, or something that you, if you're having problems with the teeth. And I'm not telling you not to go to the dentist. Go to the dentist, listen from him, but use calcarea floor also. You can also combine that with calcarea phos. Calcarea phos is again calcium, but it also has phosphate in it. So it is useful again for connective tissues, okay, like this in calcarea floor. But what is more important is, since there is phosphate in it, so it is good for blood. It's very, very useful for bone development and for anemia. Okay, so calcarea phos, or calcium phosphate, and ferrum phosphate. We'll talk about that later, because I don't want to finish all my class on these tissue salts. I'll send you. You can read it. Use them for at least 6 weeks and more to see the effect. They are useful. Believe me, they're useful. I use them, and I let my friends use them, and they are very, very useful.
So
So
can we use calcarea floor and calcarea phos together?
yes, yes.
Alternatively?
You can use them together, because Miss Marinda Castro, she is the one who I call queen of tissue salts nowadays, because she has done a lot of research. She has written papers. She has done workshops. I have taken those workshops from her also. And there are other people. I'm not saying there are a lot and lots of people who are doing great works, but I enjoy her writings. And she says that you can use 3 tissue salts at one time. Okay, she has a shop online. You can go over and look at that. You have to buy at your own discretion. I'm not a
Okay.
promoter of anybody's shop, but there are good uh, things over there. It's up to you. It's for your personal decision where to buy. But in some areas or Amazon, you'll see 12 tissue salts in one combination. She recommends to use no more than 3 tissue salts at one time. She recommends. I took her workshop, and that's what she recommends. But there are other combinations. So I follow her, because if you follow so many people, it's very, very confusing. Okay. So that's what I would do. So, yes, Sister Sadi, like you say, you can alternate. Yes, you can alternate. Or you can find a combination in which there are 3 tissue salts in 6x. Make sure that the potency is X, and either 6x or less. That make sure. Okay. Anyone else has any question?
Yes,
So
I have 6x in tablet form, so I can take three tissue salts, three tablets at one time
Uh,
in the
yes, you
matter.
can. Yes, you can, because they come in combination, in one combination also. But if you want to separate them, like 5-10 minutes, that would be good. So let the body absorb one thing at one time. That
Okay,
would
okay,
be,
got it.
that's what is recommended. But because in some cases, they are all three of them combined in three tablets. Okay, so the three tablets you would need just for one, because they're all combined. So in this case, you're taking nine of them. So if you have them separate, so take them. That's my recommendation. I would do it. I will take three at one time. After 5 minutes, I will take three. And if you're taking them one time a day, then use morning, afternoon, and evening, three tablets each. That is how I would do, so that I would let my body experience it full at the fullest, with one tissue salt at one time, if you that's what you have decided to do, and that is recommended. Is it good for the kid? Of course, sister, it is very, very good, because kids are growing. And kids are growing, they are spoiled. Why? Because parents are doing their best. I'm not complaining, blaming anyone. So they are picky in eating. If they have lots of food, or if some of the children do not have enough food, then they don't have enough to eat. So they get their own tastes and etc. Yes, please. It's very, very important for calcium phosphate, ferrum phosphate. The other day, someone was asking, so I told her to use iron phosphate. Again, blood, veins, arteries, bleeding, early stage of fever. So, blood for iron phosphate, calcium phosphate, extremely useful for the growing children. Yes, please do. Please do. Okay. So, that is for this. I don't know where I put this levels of health thing. I will look it up, and I will share with you. It should be. It should be. I don't want to waste my time in looking for it. I will send it to you. So, okay. So, what did I do about? Okay. Now, Sister Umama asked me that she wants to know what are the levels of health and the reactions. Okay. In Levels of Health by Professor Vitokas, he talks about the reaction of the body to the remedies given. Okay, there I took a course. Remember, I did CCH, which is classified clinical homeopath. I took a 8 weeks, no, 8 to 10 weeks course by a lady, Miss Deborah Monelex, and she taught us. She she didn't, I would say, she mentored means she gave us a timeline, and she gave us a model of what to study from where. And it was just coming to the class and sitting over there, and we were all, I think we were 6 people, and five of us passed, and we were new graduates. Three of us was from International Academy, and three were from other academies, and five of us passed. The other lady, she was about to do it. She had some family commitments. That's why she couldn't pay attention as much as we did. So, so Professor Vitokas has given these reactions, or the reactions of the body towards the remedy when the remedies are given. And Miss Deborah, she interpreted them, and she wrote her interpretation. And that's what I'm reading from, what has been given out by different homeopaths who are extremely knowledgeable. So this is done by these homeopaths. Okay. So, like we said, when you take a remedy, and if it is the remedy which fits with the picture of the person presenting certain symptomatology, there is an initial aggravation. Means for a couple of hours, the person, he or she, they will be in aggravation in energy, mental, emotional, and clinical complaints. Okay, so the person might feel tired, will go to sleep, or if there is fever, it's not going to go, oh boom, up. No, there would be some, you will feel that there is some stimulation in the person. Okay, and then everything would improve. This happens in group A people, and beginning of group B. Remember, I told you 12 levels and four groups. The first three levels in the A, the second three in group B. So, the first level of health, they rarely get sick. They have very strong immunity, they have very good health, mental, emotional, as well as physical. So, they rarely get sick. But the level 2 and upper part of group B, if they get sick and you give them the remedy, there is initial aggravation, but they will feel better in every way, and the prognosis is very good. So, in that case, please don't try to repeat those remedies or any other remedies. That's why I'm introducing and I'm reminding you about the tissue salts. If the person comes and they say, oh, no, no, I'm not feeling, no, nobody can live without any kind of I would say stress. There's something which bothers you too much. But if you feel like, oh, la 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 la, you'll be like in a la la land, that doesn't happen. So in those cases, what many homeopaths they recommend is give them placebo so that they will feel that they are getting a remedy and they will and but the thing is I gave you, I think, did I give you the duration of action of certain remedies? If I have not, then I have a chart which about important remedies, their duration of action is, some of them they act for 2 months and more. They're longer acting. Okay. So I will give you, so give them tissue salts. That would help them with their um, basic health, improve in the diet. Go to a nutritionist. I'm not a nutritionist, so I can just give you general information, but to be more specific, sister, go to a nutritionist to ask questions. That's my suggestion. But go online and follow some a proper plan. So nutrition, exercise, and then your own comfort, emotional comfort, who you like to talk to your creator, and go by that to accept your present situation and try to improve it in every way. Okay, that's why my suggestion. So this is the first level of health. Remember, the last time we discussed about the second level of health. This is also for the person of any level. The thing is, you will not see aggravation. They will be better in all cases. They feel good. They'll physically, they feel, oh, I'm all right. Oh, mentally, they will sleep good. They will say, I'm much, much better. Okay, it means it was all good. They are uh, better, and maybe the aggravation was so mild that they did not even feel. So it's a good prognosis, and it is also in better levels of health. So again, wait. And some people they don't like to wait. So take tissue salts. Okay, take tissue salts. Accordingly, I gave you a chart. So take tissue salts. I think two of them is enough. The third one is this one, this aggravation. And I talked about that on all the levels. But they do get better, but some of the symptoms they still remain. Okay. Then what is that? That is, they are doing good, they're all better. And in this case, take their symptoms, and maybe there is a complementary medicine or the second remedy underneath who is showing up. So they will get better in all the symptomatology, but some of the symptoms will stay. It means the main symptoms were covered by one remedy, but other symptoms are not covered by this remedy, so they're going to stay. So in 1 to 2 months, take another follow up, see where the patient stands, and then you can start a complementary remedy. But, sister, let me tell you, this is what we are taught when we are going to homeopathic school. So, what I would suggest for you, because you want the information, and information is all good, go to the homeopathic school, okay? And IESCH is the best. For me, I went there. Okay, so this is the third level of the type of reaction. So this is what we have done for this. So let's come to the pain. Anyone has any questions so far? If you have any question, anything that you want to discuss or ask, please let's do so so that we can go to the next part.
Sister, last time you said that one must have the A, B, C's at home. So,
Yes.
in when it comes to cell sorts, which one would you recommend
No,
to
no.
keep at home?
ABCs are for emergencies. Okay.
Okay.
ABCs are potentized remedies which you have
Uh-huh.
to give when the person is in severe pain. You get up in the middle of the night. Okay. And
Mm-hmm.
somebody is experiencing excruciating pain. So you say, oh, something has happened. Let me rush to the ER. Before
Mm-hmm.
that, give that remedy
Yes.
and see if the person feels better. For the tissue salts, no, buy the tissue salts accordingly and then use them. Tissue salts, I'm not going to, I'm like I told you, they're 6x. They are not recommended for acutes. Okay. They're not for this kind of acutes. No,
Yes.
not they're not for this, so there is no ABC for acutes. You have to get those tissue salts depending on what you need them for, like for the teeth or for the varicose veins and all that. So they are
Jazakallah.
okay. Vaiyakum. So anyone else has a question?
Yes, I have.
Yes.
Um, you showed us all those charts for aggravation and then mental,
Yeah.
emotional, and physical
Yeah.
levels.
Yeah.
They are getting better. What if nothing is happening? I'm no aggravation, no change. Then
That's
what
a
would
very
be?
complicated stage then,
Mhm.
because in
Mhm.
that cases,
Mhm.
that can happen. That can happen. Let me show you. That are in when the person is, it means if there is no reaction, it means these people are in lower levels of health. Their immunity is suppressed. Okay, you don't see them, but and they don't feel it. But in this case, the weight and observation is very important, because Professor Vitokas says and Dr. Henneman said, a homeopath is unprejudiced observer. Sister, this is a very deep word. Unprejudiced observer. And that is, and Sister Sadia, you know, you are a doctor. That is why we are told as doctors not to treat our loved ones, because we become prejudiced. We want them to get better as soon as possible. Okay, so you have to be, so in these cases, these patients, they might show some symptomatology at a later stage, but at the same time they do not say that anything is getting better, because they don't want to accept this one. See, no change. This is 13. Okay, again in this case you have to see what person is, level of health the person is. If it is in the upper level like group A or group B, then maybe the remedy is not correct. Okay, so in that case, change the remedy, change the pharmacy of the remedy. Maybe this remedy had expired. It might be or might not be the fault of the pharmacy itself, but you have to change the uh,
Mhm.
pharmacy of the pharmacy. Okay.
What do you mean by pharmacy of remedy?
For example, if you're buying it
Both?
from Boron, I don't
Oh,
know.
oh,
I mean, I don't
oh,
want to take
okay, okay.
any of the pharmacy's name. You bought it from one pharmacy, so buy it from another pharmacy. Maybe you bought it, if I'm living in US, I bought it from one of the pharmacies in, there are a couple of pharmacies. I bought it from pharmacy in one of the pharmacies. I'm going to order it from a different pharmacy. You
Mm-hmm.
understand?
Yes.
So I don't want to take names because they're all doing their job. So I will not say, oh, it, because now I am recording it and it's going to go online. So I don't want to take name or this. That would give me, even if nobody listens to my videos or whatever, ethically, I want to say is I don't want to take names. Like I don't
Okay.
take patients' names. So if you're using it from one pharmacy, change it to another pharmacy, buy it from another place. That's what thing is. Okay. maybe the remedy is not they spoiled, or in the second case you have to change the potency of the remedy. Okay, second. Third thing is you retake the case and you have to see whether maybe you missed out something in asking or patient missed out something in telling. Okay, you got it, sisters? Anything else?
Is there an antagonistic action between two remedies?
Is there a reaction?
Antagonistic action.
Sister, that is why we don't give two remedies at one time. We just give one remedy. Yeah, there can be cross reactioning. There is in the relationship, some remedies follow well after another remedy. Some remedy, if you give after another remedy, we'll talk about the relationships at one point. I can give you some information about very well known remedies whose relationship. Because if I'll start talking about that, I have prepared a document which has the remedies. Some remedies you cannot give after one remedy because they're inimical. They do not act well after one remedy. Okay, so I'll do a class for that. That's a very good question. But there are remedies, but we are not giving two remedies at one time. We are just giving one remedy. Okay, make sense?
Yeah.
Are we all good? So this is the answer to Sister Sadia. If there is no change, okay. But there is or a little bit more details into that, in which you have to be very careful about whether there is a change or there is no change. You will ask the person, oh, did such and such? Yeah, I think I'm changing my diet, so I'm feeling a little bit different, but I don't think this is because of your remedies. So there some people it is very hard to admit also. And I'm not telling you to make them admit it. You will see them in better spirits. You will see them in better physical. You will see the change which they are not noticing because they expect from point 1 to point 10. Okay? So there are this is a little bit more details. So let me tell you, share with you some. Okay, so along with that, let me share with you, I am using this free form. Okay, free form. Free form, who all of us who have Mac Pro, this is a free application which is called free form. And see, I have made different free forms. This is my free form which I have kept for homeopathic notes. And see, I have even added books, and it takes the books. This is 7 MB book, this is another book, and this is another book. So it will takes the books, and what we can do is we can open the book. I can read this book over here. Okay, I can read this book over here. And how big is this freeform? Infinite. So that's why I'm adding all my things over here. This is really amazing application. Try it. You would enjoy it. I'm enjoying it. So let me tell you, I have collected and I have made these uh, charts from different my professor's books, and also Boningossen's. He is very, very well renowned. His lesser writing. I made this from Ellen. I made it from other books, lot of books, because I am using this. I told you I have subscribed to one of the channels, so I'm using different books, and I'm reading these books online with something that would help me read them faster. And so I prepared these charts. And what I want you to see, you ladies to see, and my viewers, if somebody would like to view, is just see what they are telling us. Why am I making so much? Why? Because I want you to see what is the difference and what are the similarities. Because everybody have approached. Some of them are in Europe. The other ones, there is one by one of the Indian homeopath, because India is very, very famous, very, very renowned, and they're doing a lot in homeopathy. We have to acknowledge the work It's a lot in homeopathy. So let's see. This is homeopathic crisis. This is the first chart that I want to share with you. And guess, my dear sisters, what you see. What you see. That is what I was talking about, Sister Sana, to keep in ABC. Okay, let me make it bigger. The first thing, what you see in this chart. You want me to make it bigger? This is what it is letting me make it bigger.
Arnica.
Arnica. Wherever you go, keep arnica. Sisters, accidents, bruises, because they can happen. Somebody can fall on the street, somebody can get their foot twisted, somebody can get their hand caught in the car door, anything. Arnica. Do not forget arnica. Okay. So then arnica, you'll see. Then there is constricted chest pain, cactus grandiflorus. Again, this is something remedy. Again, this was also, this is okay. Then I used arnica. This is arnica is very, 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 very useful. I cannot say anything which is more than that. Now look at this agonizing pain, sister. This is Lilienthal. Lilienthal is a very good book, sister. I was so happy when I got this book online, and now I have put this chart together about the remedies talked in that book. And guess what he has said, which we talked about earlier. He is talking about this is life threatening pain. This is what I'm talking about, to keep in that kit. Carbo vegetabilis. You will read about carbo vegetabilis. It's made from the charcoal. This pain is excessive and feels like burning. They want to be fanned. Why am I doing? Because sometimes seeing is believing. They are people have been saved by the of course their time, like we believe they had the time, but this decreases the agony. Carbo vegetabilis. Then over here, like you will see, life threatening pain, vital crisis. They are talking about vital crisis. Okay. Then if you will see, this pain is where is, because over here he is not talking about the pain due to injury. Okay, so this is why arnica is not there. Otherwise you cannot go outside without arnica. But carbo vegetabilis, if somebody is really, their hand and feet are cold, they are blue, put arnica. Call your health professionals, let them come and do. But so in this case there is complete, this is called corpse reviver. Corpse reviver. What is the meaning of corpse? Dead. Reviver, revived. This is one of those remedies. Aconite. Severe pain. Pain, a person is in severe, so severe pain that he is afraid of dying, but he will tell, oh, I'm okay, because he doesn't want people to touch him. And if you leave, he'll faint. Arsenicum album is again a remedy for acute severe burning pain, especially the people in their last times. Okay, arsenicum album. So there are more, but these three, again, in like Sister Sadia, if somebody is having extreme degree of abdominal colic, extreme degree, and it is colic, it means it starts and goes down or goes up, and they are pinpointing, I have pain over here, it's very severe. Colucint. And what is the potency that you're going to give?
30.
No, ma'am. Pain is very
200 in the beginning.
huh?
200 in the beginning. First dose.
What Dr. Luke and what okay, it would not be from me. What Dr. Henneman has said, 1 m. 1 m. How much? 1 m. Okay? At least 1 m. So for your emergencies, you have to have at least 1 m. Okay? This is the same, kind of same, but these are from different people. But okay, this is again severe pain. Again, there comes your C. The belladonna is down, but this magphos and belladonna. belladonna, they are very, very useful pain when there are cramps in the abdomen. Aconite pains are intolerable and they will say that I am going to die. No way, I am not living, going to live. I am dying. Aconite. And you have to give at least 1 m or more. Okay, one time. 1 m or more. Chamomilla is person is extremely oversensitive to pain and they're very, very irritable. In aconite, they will say, I'm dying. I'm not going to do such and such thing. So it's at your own discretion, but these are the ABCs. This is Sister Sana. I'm talking about the ABCs
Yes,
of.
doctor.
So these are the ones you have to use the tissue salts as kind of the remedies which you will use on a regular basis as follow-up and on day-to-day basis, But this is, where is Professor? Okay. Okay, this was by Professor Vitokus. He said that when the pains are so severe, this is was his pains of all kinds that are so severe that the person they would literally they want to commit suicide because of that pain. That pain can be mental, emotional pain, more, but it can be physical. It goes through, they're going through crisis. Sister Sadia, you have, when somebody has trigeminal neuralgia, can you imagine trigeminal ganglion
Yes,
and then it's going and it's pain? Oh my God. Thank God I have not
piercing
experienced it.
pain.
It's severe pain and the pain is driving the person. They would want, it's the face. Face is extremely sensitive. We're talking about the hand. So this kind of pain, aura metallicum, Professor Vitoka says, use aura metallicum. Okay.
I haven't seen such patients in real
Yeah,
life.
we don't see them because
Mm.
okay, for whatever reasons, let's discuss what we have in front. Carbovegetabilis is for collapse. If person has collapsed, is blue, and they are cold, and they want to fan, and they're breathing, they want to be fanned. They would say, carboveg. Put that in her mouth or in his mouth. Okay, very useful, very, 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 very useful remedy. Again, this was from Professor Vitokus material. So aurum is for again for deepest depression. The person, people who work very hard, they are doing their level best, and in order to avoid the pain in life, they immerse themselves in what? In work. But they're not satisfied with the amount of work they're doing. They're doing it so much, they're perfectionist, and they feel like they're not done enough. And they want to, and people have done it. They don't. Aura metallicum is severe mental, emotional, psychological crisis pain. And again, like I told you, over here is yeah, severe pain and crisis. There, bruises, specific pain conditions. Sister, these are the two remedies, arsenicum and carbovest. They are both very, very useful in acute severe pain when the life is at the end. Because the other time I was talking this friend of mine, her one of the family, I don't know how close family members, they were in India, and one of the family members, he suddenly had stroke, I think. Yeah, stroke. He was taken to the hospital, and they did what they could do, and he was comatose, and it was expensive hospital, I believe. And they told the hospital officials and the health professionals told the relatives of the patient, we cannot do anything. So you're just wasting your money, and the time is going to be soon, and the person is dying. So take him home. So they brought him home, and they were expecting him to pass away. So, sisters, at this and in this time, what you do? The person cannot say what he's going through. So, what is suggested by the homeopaths, masters, is keep the arsenicum album, at least 10 m. That will help relieve their pain and agony, because we can see, anybody can see that they are in stress, right? So this is what is vital force is so weak, and or if they are cold in hand and feet, carbo veg. That is what I'm saying. And she told me, she said they were expecting him to pass away in less time, but he stayed alive for a couple of hours and then he passed. So carbo veg or arsenic, give them arsenic amalgam. Okay, I told her, I said, sister, you know me, why didn't you call me? Or if they don't believe it, okay, I don't want to get into places where I am not needed. So this is what it is. Again, severe pain and crisis, arnica, arnica, arnica. Keep it with you. Cactus is for severe constricted chest pain. It acts like magic. Intense. To call the doctor, or I mean ER. Even if you rush to the ER, how long will it take? 10, 15, depending. You're not sitting in the ER. Even if you're sitting in the ER and you have to go get him checked, give cactus and then do what you are supposed to do. Again, severe pain in the abdominal region, belladonna and colocynth are the two top remedies, sisters. Two top remedies. Terminal pain and suffering, arsenicum album. Terminal pain and suffering. Okay, it will provide a peaceful death and it will ameliorate the sufferings. It is used in incurable cases like cancer, last stages where doctors have or health professionals have given up and told you to take your loved one home. So this is what professor says. He says pain is a defense mechanism, like headache, severe headache, and you want to go relieve it. You have to see what is it giving you an indication to. This is a life-changing event. That's why, oh no, I'm having a low battery. I'll have to go down or it will die something soon.
How can we say patient is dying a peaceful death after this? He
Arsenic
is not
amalgam.
going, he or she is not. Yeah, but the patient is not going to tell us that
You will
it's
see.
pain-free death.
Sadia,
Mm,
you will see.
mm.
Have you done the internship? When I was doing my residency, I could see when the patient is in severe pain, they're moving their heads. I mean, no matter the drip is going on. I remember there was this one case, he had prosthetic surgery and he was old, he was sick, and he deteriorated. So from after the surgery, he was moved to the ward, but his condition did not improve. He started bleeding, so he was moved back to the ICU, and then he looked like in severe agony. We were giving him the painkillers, he was given the medicines, but he was moving his head. He looked like he is in agony. So there was a guy next to him and he was going here and there. It was not Pakistan, it was in Pakistan, it was some time ago. And he was calling this relative. That I said, I do you know Quran? He said, yes, I'm he was very well educated. I said, please sit by him and read Quran, because I'm a Muslim, I believe in. So I said, read, even if you have to be a little louder so that he can hear you. And he died in a couple of hours. You can see a patient in agony. If you're a doctor, if you're dealing with them, you can see. And if not, the doctors will tell you that your patient this is terminal. We cannot do anything. His vital signs are up and down. You can see that. So over here, I'm not making people doctors or health professionals. This is what it is. Do I make sense? So my idea over here is, again, I just collected this information from different books and I'm making these charts because this is what they have suggested. This is Allen keynotes. Okay, then again, aconite, chamomilla, coffea is for intense severe pains, which is insupportable. Again, severe acute pain, shooting pain. Again, cactus. So all these books are giving us aconite for sure, for injury, arnica for sure, for severe degree of. Some people, they will be cursing and they will be screaming and they're in so severe pain. Give them chamomilla. Okay, chamomilla. If they're severe pain in the agonizing abdominal pain that compels the patient to bend double, just like a fetal position, they are standing, they will just, oh, and they want to press their abdomen, and they have so severe pain. I had this pain. I remember this pain. So give them colocynth or give them belladonna. Okay. But if they don't want to move and their pain is aggravated by movement, give them bryonia. So this is again arsenicum album for severe pain, burning, and in agonizing pain in the last stages. So this is what I had for pain, and why I gave you all of them, because these are all by different professors and doctors, and this is what it is. And let me go over some notes. I have to go down. Okay, it will. I don't want this to die.
Yeah, yeah, it's
My computer
going.
is dying. I
Yeah.
have to go hook it up. So I hope I have some left. If not, I will show you guys. So anyone has any question? Let me go down and hook it up. I hope I get a
So
different.
we have to keep arsenicum album in 1 m at least for emergency use.
Yes. So after looking at that, aconite, arnica, arsenicum album, belladonna,
Mhm.
chamomilla,
All
also
these in
colocynth,
1 m potency.
at least 1 m or more.
Okay.
Colocynth, carbo-veg. Remember, I
Hmm.
told you I gave carbo-veg to my mom? Remember? My sisters were crying. They're all doctors. They were crying. Mom just was. I went to a wedding and mom was sitting, and suddenly her head, it went on one side, and they said, "What happened? What happened?" And her hands and feet were cold. We traveled and we had a tough flight because, long story, and she did not sleep, and she's in her 80s. I gave her carbo-veg and she came up. She said, "What happened?" And we told her, and she says, "Oh my God, you didn't, there's so many doctors and nobody could help me." So,
Oh.
okay. So I gave her carbo-veg. I gave her carbo-veg at that time. Okay, so let me tell you, share with you. Anyone else has any question?
Oh, Sister Nishaba,
Yes.
what you give your mom is for what? Like in general?
Sister, my sister Sophia, she was crying that mom is dead. My other sister, she took the blood pressure. She's trying to look for her pulse. Her hand and feet are cold. She was sitting. There was it was my niece's wedding. Okay. And there were so many people. And she was sitting, and suddenly her head went on one side. We don't know what happened. She became, she fainted sitting. While sitting, she fainted. So it was kind of a very, and my brother-in-law is a doctor. There were so many, like dozens of doctors. They stood up that what happened. Maybe, she's old lady. So, and my sister, the third one, she is very, very soft-hearted. It was her daughter's wedding, so she just started crying, "Oh, mom, my mom is..." Because when you're a doctor or not doctor, when it's your mother. So I ran, and I had this small pouch where I had kept all these remedies. Let me show you. Like I have come down now. Okay, like this. Can you see this? So I have these remedies. I unshare this. I'll show you these remedies. I have that. Then I'll show like this thing. This is small enough to be in my purse. This thing. This is small.
Yeah, I remember this. You showed it to me before.
Yeah. And I had
Mm,
another one, and these are the small remedies
yeah.
I have kept in there. And I keep it in my bag all the time. So I have Nux vomica, I have Stephus, I have sulfur, and then I have colocynth. I have tarantula over here. There's CMs. I have arnica, uh, veratrum. I have aconite. So I have all these remedies that I'm keeping in my small this acute emergency kit, and then I keep it with me all the time.
Mm.
And I was traveling, remember? But I had it in my in my purse, so I ran, and I don't know how mom. Maybe it was Alhamdulillah. It happened more than 2 years ago. Alhamdulillah, my mom is okay. Now she's in
Mm.
Pakistan with my other sister. What I'm trying to say to you is, sister,
Mm.
she had to live. This was her life. I am not saying what happened. We didn't have to go to the doctor. We didn't have to go to the ICU. She got up and then she started talking. Okay, everything went fine. So, and then, um, and I don't want to talk more about it because if somebody,
Must be Adam's stroke.
huh?
Adam's stroke. That's a sudden यानी कि loss of consciousness.
If there is a
And
stroke,
have
again,
nothing
sister,
else.
if there is a stroke, it's because maybe because of bleeding, maybe because of ischemia, maybe because of any reason, might be some
Mhm.
of aneurysm. So again, if there is a sudden stroke, you have to see what the patient is experiencing.
No,
If
a
there,
patient comes back after Adam's stroke, usually. And during that
again, the
Adam's stroke,
name of the
they
disease is not
micturate.
important. Listen, the name of the disease is not important. It is how the person
Hmm.
is representing. If the person is
Hmm.
not conscious, we have
Hmm.
again, this is something, this is
Yes.
ABC. Okay.
Yeah. Bold
First of
decision.
all, we are not trying to make anybody, we cannot diagnose with this forum. We cannot give any specific remedy. What I am trying to promote and propagate is give something that may help in easing their pain. So, aconite or arnica. If there is sudden loss of consciousness, and you know that there is, but in my case, her hand and feet were cold. Okay, she was cold. So I gave her Carboveg. And Alhamdulillah, she came out. So let me show you something that, what is he talking about? Okay. So I have to share. Okay, let me share with you what anyone else has any question. If we are done, we can go, but I have some other things that I would like to share with you. If you think you're tired, we can do it next time.
We can do now. I think I'm ready.
Sister Sadia is ready. If somebody, because of the technical problem, I took some time in starting. But if you guys have something else that you have to do, it's up to you. I'm recording it and I'm going to send. So I have put this together. I was really looking at these. Again, this she is the Miranda Castro I was talking to you about. Now she's living in Florida, and I call her.
We don't see her.
There, this is the one. She's the one. Can you see her with the lady in pink? Oh, am I sharing?
No, just the folders are there.
Oh, I'm so sorry. Let me show you. This is what I'm sharing. Okay. Share. Okay. Can you see this?
No, it's still folder.
Okay. Share. Oh. Okay, now maybe it will share. Now?
Yes.
Okay. So this is Marina Castro. Sister Salva, I think I gave you this book, the complete homeopathy book.
Yes. Yes, I have it.
Yeah, this is a book which is written by her, and it is very, very useful, and she got so many awards for this. This is underground heroine of homeopathy, and she is Miss Miranda Castro. Okay, and she did a lot of work on tissue salts, and she's the one I'm talking to you about regarding tissue salts. In When I was reading this, she said, I do not, and not only her Professor Vithokas, and the masters, they say, we do not believe in suppressing the fever. What kind of fever? Like 100, 101. Yeah, if it is high, please uh, take lighter clothes, put the fan on, put tepid sponging, making putting your hand and feet to some water to reduce the fever if it is going raging high. I'm not talking about, but it is very, very useful fever. Okay, Dudi. Okay, and she also said, and I really liked it when I was saying, chamomilla is very useful remedy for the children. But if it doesn't seem to work, creosotum can soothe the pain beautifully. That was her suggestion, and that's why I highlighted that. Let me show you something that, okay, yeah. This is again the article. I cannot say more. Why I'm saying it in every class so that we all keep Arnica with us. This is another article on arnica. Do not leave your home without it. Hard won lessons from a hike in paradise. Paradise is a beach, Hawaii beach, I think. So these are the lessons, and this was all one talked about. When traveling away from home, always take arnica gel and arnica 30C. I would say always take arnica 30C plus 1 m with you. 1 m. And arnica gel is arnica salve, like Sister Salva we always make. So take,
Yeah.
you never know when you would need. Okay, and this arnica for what ails ya. Okay, then she wrote how there was somebody, arnica promotes healing, controls bleeding. That's why arnica is useful for stroke, sister, because it
Wow.
controls the bleeding. Because many of the strokes can happen due to bleed in aneurysms, and especially in young people, young or even now older. But I've seen a case. I was students long time ago. I was a student, and there was a young man, very young, late teens, maybe early 20s. He was brought by his family, and he was comatose. And I was really in third year, and I was really stressed because I was still not in a mode of medicine. I was still in a younger mode, and I was his family was his brothers and sisters, and they were looked so depressed because they thought he's going to die. He just went comatose, and later on investigations were found out it was an aneurysm which bled, and they were congenital aneurysms can happen. So arnica, again arnica, we don't know what had happened, but arnica is very useful after injury with trauma, shock, car accident, childbirth, surgery. People need arnica. They feel sore and bruised. So arnica is extremely, arnica is the number one remedy for bruising. Is given before the skin begins to discolor. It will not let the bruise materialize. But after the bruise has formed, arnica will speed healing. So arnica is extremely useful, sisters. Arnica. Finger magic for a physician. Have arnica, will travel. Arnica. Over here, she talked about how arnica was used when a person got out of the car and the fingers got jammed. This person was a guitar player. He came or she came out with a one hand with tightly with the other because she jammed in the door. I slammed my fingers in the car door, she said. She held out her hands to show a deep purple red gashed arrow across the pad of his fingers. Why am I reading it? For us to see. So what did this person, this homeopath, do? Wait, let me give you a remedy. And guess, sister, what it was? Arnica.
Mm.
Arnica 200, at least 200. It can be 1 m, at least. So, sister, this is acute severe pain, Sister Sadia. So she gave Arnica 200. Okay. Before that, no, she gave her Hypericum first. Why Hypericum? Why Hypericum? Because it is a nerve-rich area. Nerve
Neuralgia.
area. So gave her Hypericum. She felt better. So she felt because of the severity. How does it feel? I asked after a few minutes. It hurts, she said. So this person was given hypericum because it was nerve area. She said it's still hurting. And how many minutes? Few minutes. Why am I reading that? For you to see exactly what people have been doing in few minutes. Ask. It hurts. So what did she do? It did not bring the pain relief in few minutes. Few minutes means less than 10 minutes, okay? In couple of minutes, 2, 3, 4, 5. So what did she do? I gave her a dose of arnica. So don't wait for hours. In couple of minutes, if hypericum didn't work, gave her arnica. Okay. And what did she say? I asked her in few hundred feet on the rest at the trance. Jill asked, "That's weird. It stopped hurting. Can it works that fast?" So she didn't expect that to work this fast, but it worked. Yes, of course. When you take arnica immediately after the injury, it stops hurting. And then grab the cup of ice from the fast food and begin dunking the finger. This is the person. And then as she said, if it is started to hurt again, what did she do? What did she do? Gave arnica another dose. Okay, in 1 to 2 minutes. Now, couple of minutes in 1 to 2 minutes. What happened? It stopped hurting again. So she said I gave her both the remedies to take another dose of Anika if she felt the pain again. Why am I reading all this? For you to know when you ask me, how should I give? When should I give? In acute, give as needed. Means it gets better, it comes back again, give again. But if there is, say, if there is severe, you can go to the doctor if there is any bone injury, etc. But this is what you are doing at your end. Okay. She said, I also suggested take hypericum if she think arnica is not helping anymore because now it is in the stage in the realm of hypericum. Okay. So are we good so far? Why am I reading this is for you to see how to dose it when the situation is acute. That is why I picked this scenario and I want you to see how it is being used. Okay. She said that during the next leg of the drive, I noticed that taking 2 or more doses of arnica about 20 minutes apart, she felt asleep for over an hour. She woke up, she studied her finger. The gash was silvered, it looked less deep, finger didn't look angry, swollen. She went to sleep means a lot. And then she said when she got home, I gave her arnica 30, advising her to take it as needed. This is important for us to know. Take it as needed. Pain, take it. The next day she emailed me, my finger is doing amazingly well, almost no pain. I can even use it because she's a guitar player, remember? And thank you so much and all that. Important. It's first-hand arnica experience like this once and can open a person's eyes to wonders of homeopathy. So why I wanted to show this was that how often in acute as needed. Pain should be gone in couple of minutes, 2 to 3 minutes. Okay. This is arnica. Okay.
I have a question.
Yes.
It's like if I notice the child, he running fast and then he hit the door with his nose and start bleeding. I can give her.
Yes, arnica. Remember? Okay, let me show you. Remember.
For bleeding.
Wait. See, arnica promotes healing, controls bleeding. I gave you this reduces swelling because once you hit the door, it will be so again, that's what I talked about. Promotes healing, controls bleeding. So arnica. First and foremost, in acute injuries, everybody has said arnica. Okay.
Oh, okay. Jazakallah khair.
If someone wakes up with
Yes, go ahead.
If someone wakes up with the pins and needles in fingers or toes, so arnica again, maybe a nerve compression is the cause.
If somebody has
Pin and needle sensation, yeah. After
okay. There are some remedies, which is one is called ledum. That is especially very, very useful for um, anything which is pierced, ledum. But give arnica first. Like in this case, the pain rich area, they say give hypericum, right? She gave a hypericum, but
It is,
again,
it is
it
nerve
didn't help
compression.
as
Okay.
much. So then she had to give arnica. So give arnica, and in the next stage, maybe you need lidum. Lidum is specific for piercing something due to nail, something which is pierced. So there would be in the first
Oh
thing.
no, no, it is pin and needle sensation, maybe because of nerve compression.
No, no, sister, this is about injury. That is another symptomatology. What you are talking about is
Okay.
a symptom in which there might be some pain, or there might be small,
It's
there
an
are there those are specific pain rubrics which you have to look up. But I'm talking about the pain.
Okay, injury and okay,
Yes,
piercing. Okay.
yes, yes. So then this second article was about hip pain, and this person had hip pain and went through a lot of remedies. And I don't know if I have to go through chronic pain and opioid epidemic. These are the remedies that this homeopath is discussing for hip pain, specific for hip pain. One of them is brainia. What is the important symptom which brainia for brainia? They don't want to move. Okay, they don't want to. Pain is worse from motion and better by heat and compression and rest. And then there are other remedies. Rustox, I will show you. Rustox is another remedy which is worse with first movement but better on continuous movement. So there's a lot to talk about, but we don't have that much of time. But brainia is when you don't want to move. Uh, okay. Then this other was about, okay, this is what I have in this, and why I wanted to read to you was because I want you to see. Did you see, can you see this homeopathy again, the second one? Can you
Yes,
see?
October. Yeah,
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 okay. I
yeah.
want
I'm
to
getting.
just share a little bit about these homeopaths who visited India and they saw what they saw. I just want to share a little bit on this about how in India these homeopaths are working with different. Okay, this was about Banerjee, a family tradition of how they are helping lots and lots of people in okay, so a day in Calcutta slum project clinic. So there are really, these are people are really poor, and these were the doctors. Dr. Banerjee's, he treated. Now I just want to read a little bit on this, that how these cases are shared and how, just a glimpse.
We
uh,
don't. I don't see any case.
can you see case 3? No.
We see calendar of events 25 to 29 Burlington.
No, no, no. Uh, no, no. I opened another one. Okay, let me share this now. Start share. Yeah, now this one. Can you see now? A day in Calcutta Slum Project Clinic.
Yeah, yeah, yeah.
Okay, just let me show you a little bit and then we'll call it off for the day. So these doctors are working in slums and they're seeing the patients over there. This case came of bleeding hemorrhoids. He had surgery for anal fistula. Anal fistula, Sadia knows, there is a abnormal path formed. He reported gas and distension in his abdomen. Dr. Banerjee gave him lycopodium 200C last time, means when he came earlier. And now How is he? He reported that he's 60% better. His bleeding hemorrhoids are no more, and he feels 75% better. So, doctor, and he's given 200 lycopodium 200C one time only. Since he is getting better, so no remedy is given. But so some people, they do not live without any remedy. So to them, give tissue salts. Okay? Because they have to have something, rather than they go out and take some other medicine which will give them tissue salts. Look into the tissue salts, which is very, very useful for gas. Give them the tissue salt, and you have to tell me what the tissue salt is. Again, this is another case in which there is a 25 years old woman. She came, 25 years old woman, and she went through hysterectomy. Okay, she went, and then she had pain and tingling in her perineum, in her area where, in the lower part of her pelvis. So what was given? Because of that, she was given Bellus perennius, one of the very, very useful remedy after arnica. Bellus perennius, 10 m. What is 10 m equal to? What is 10 m? What is m, sisters? And
10,000.
10,000. Yes, ma'am. She said she's 100% better. Only there is some gas in the abdomen. So she was given Calcarea phos for the gas. Okay. And the patients mostly, they come back in 1 month or more. Another case, 4 years old girl was treated for asthma. Was originally came for asthma. She was thirsty. She had hernia. Dr. Banerjee and the previous appointment gave her Brainia 200C once. Okay, she is 100% better. 50, her hernia was 50% better because patient is improving. So wait and watch. No more remedy. But if they are eating your head up, give them tissue salts. But tissue salt, I give them tissue salts. Another case, post poliomyelitis syndrome. Since it was a slum area, poor habitat, they can have these diseases. Atrophied right arm, could not move his right hand. He was chilly, person desired sweet, hot, and sour food. Dr. Banerjee. Now, again, lycopodium. See over here why I picked this case, because in this case, hemorrhoids and fistula, gas, and abdominal distension was given lycopodium. In this case, again, post poliomyelitis syndrome, desired sweet, hot, and sour food, lycopodium 200. So, Sister Sadia, it's not the disease, it's the presentation. Okay, again, patient was 50% better. So patient is improving. So what remedy? None. Wait. Wait and see. Maybe there is some new symptoms, then we have to act accordingly. Do it make sense? So we go on and on. This is how we have to treat. The classical homeopaths are treating. This I was also very interesting. This man, this person, he's called Dadaji, and he is working as a homeopath since 1965. 65. He was a monk. He gave a homeopathic exam and he passed it. He was surprised when 67 his spiritual preceptor instructed him to sit for an exam to become a certified homeopath. Certified Dadaji was only one of the only examiners to pass the exam. And then, long story, he started treating the patients and he's giving them medicines, and he is taking 1 rupee and couple of other some money because for the remedies, and he's given one remedy at one time. And how many has he treated? More than 600,000, because he's writing. The next patient was 5391917. Okay, so this okay, this homeopathy, he said, I asked Dadaji if he had any words of advice or encouragement to the modern student of homeopathy. Now, this person who is treating the people for last 50 years, 60 years, tell them homeopathy can be used to cure any disease. This is what he said. Okay.
That's, Sister Nechaba, how you can send for all this? If
I
this
will
is in
tell you.
the
After
magazine.
such a lifetime of service and experience, he has treated more than 650,000. Okay, more than 650,000 patients, consultations and counting. Who can argue? He said, tell them that homeopathy can be used to cure any disease. Okay.
Is he still alive?
I
I
can
know
see
it's
his
Article is
dispensary.
written by this person. If he's still
yes.
alive, I don't know. Mr. Salman.
I know it's a dumb question, but it just come in my mind.
I
My
know.
mind.
I don't. Maybe he's alive, but he is somewhere sitting in India. He is a monk sitting in India, and he is treating the people since 1990. And this is
Oh,
article is written by this MD, ND, Doctor Homeopath Timothy
mm,
R. Dooley. And he went to India to see these patients, and then he came and he talked about him and wrote down this article. And he works. He is from naturopathic medicine as well as Oregon Health Sciences University School of Medicine. He practiced homeopathy in San Diego, California, and has taught at the Southwest College of
mm,
Naturopathic Medicine and Health Sciences. So he is of author of easy to read introduction. So this is about him. He went to India and he observed this monk doing the homeopathic work to uh, for the people, and this is what is coming from. It's not coming from this monk. I'm not. I don't know if this monk is alive or not.
I
Okay.
can see his dispensary behind
Yeah,
him.
see, this is the dispensary behind.
Mm.
mm.
Okay, and then there, again, Dhawali Memorial Homeopathic Hospital in India. This person, there is a lot to read, but this is there was this one girl brought to this hospital because the parents could not take her anywhere. She had severe meningitis or she was unconscious for whatever reasons. They could not take her. They brought her from very far remote village. So it was a classic case of meningitis. And what they did over here in this hospital, they gave her opium. And how did they, it revert? Fever was controlled, and there was a chance that she would recover, and she improved. Okay.
Mm.
So, and this is in the remote area. So, this is written by another doctor over here. This is the person, CCS, Liliac, practices homeopathy in Bartleboro, Vermont, and can be reached at such and such place. So, these homeopaths and doctors, they visit different parts of the world and where they bring the information and employing Boning Gosson's method. Remember, I shared with you some remedies and for pain by Dr. Boning Gosson. This is Boning Gosson. He is very, 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 very dedicated, hardworking homeopath of history, and his work needs to be acknowledged and read. And I shared with you. Okay. So, anyone has any question? I think we did a lot today. Next time, what do you want to study? Do we have any question?
Sister Nashaba, what about fears? The
FEAR?
best, yeah, fears.
Okay. Okay, let me share with you this document. I prepared it from, okay, fear and anxiety remedies. Aconite, again, always remember aconite. Aconite is, that's why I told you to keep it in your purse all the time. These are all the remedies which they have put together for fears. Okay, so first and foremost is aconite. Then for the children, I have seen for the children, they have fear of dark and ghosts. Stramonium works very well. I've used it for young children. I've used it for teenagers. They cannot sleep at night with the light off. They cannot. They have nightmares. Stramonium, please. But again, this is the chart I sent you for fear and anxiety. Very, very important aconite. Fear. And then these people that are very these people are quite okay. One more thing, sisters, sometimes we use these remedies not for their classical presentation, and so just take them with with what I'm saying. Arsenicum album is again used for people who are fastidious. They have also fear, okay, and they are very fastidious. Then gelsemium. Gelsemium is very, very, very useful remedy. I was listening to this one talk, and I took a workshop with a lady who is a nurse and a midwife. And she said that gelsemium is very useful remedy, especially for women who are in labor. And this is a remedy because there is a lot of changes going on when a person is in labor. Okay. There is an anticipation of having the delivery, there's anticipation of having the baby, then the anticipation of how it's going to be life. There's a lot of anticipation. So this is gelsemium some prevalence. This is over here, if you can see, stage fright. This is about changes. They feel paralyzed from fear when the things are they have to go and present. And I like that she said, the midwife, that in this, when pregnancy and during labor, there is fear of so many new changes, right? New things, delivery, then after delivery, and during pregnancy. So she said the gelsemium is extremely useful remedy for fear before you go for a presentation, and also for things where things are changing in life. Gelsemium, very useful remedy. Like I told you, this stramonium for children, especially when they get afraid during night, they get up, start screaming. They scream and they get stuck to the mother or whoever they're sleeping next to. Stramonium, I've used that, and I've given it to so many children and also adults for fear. Sometimes it's fear. I had a friend and her son. He would go and he would drag the hair of another child, or go hit another child, and would say, "Oh, I'm going to do such and such to you." To me, to her, it doesn't look like she's afraid. I gave him stramonium, and she said his attitude has changed. It's much improved. He's more calm. Fear in itself can represent either the child is timid or the child is aggressive. Okay, so I have used these remedies for fear. Aconite, I've used aconite for fear. Arsenicum album and stramonium for fear. I've used that. So, and over here, sleep related fears, fear of, so these are the emojis for used for this thing. Fear of dark, ghost, dreams, night terrors. Stramonium, first and foremost. Stramonium, very useful remedy, sister. And what happens when they listen to music? Aconite gets sad. Ignatia becomes weepy. Belladonna excited. These are the said by different homeopaths and how these things are put together. Anything else?
Could you review fear of health?
Fear of health over here, fear of death, fear of death, fear of being alone, fear of disease, contagious disease. So this is fear of health, right? Fear of disease is fear of health.
Yes, yes.
So
And these are Arsenicum album,
yes, and
right?
they want to be with somebody, but they're critical of others. They don't want to be by themselves.
Hmm.
And they're very, very, they get cold very easily. And they
They
get,
get cold very easily or hot
yes,
very easily.
they get cold very easily. They're chilly.
What about the patient get hot very easily and still have fear of disease?
I don't see sulfur. Sulfur is not here, but sulfur is, you have to see then these two. Start with, okay, now in this case, Romama, there can be a mixture of two remedies. Okay, that can
Okay.
be the two layers are representing, I showed you, right? There is, I will show you the next time, the peaking going, some things are peaking. So remember, I showed you that some symptoms would improve, the other symptoms will become clear. So there might be the symptoms of two remedies presenting. So once you give one, the symptoms of that remedy would go away and the symptoms of other remedy would become obvious. Do I make sense?
Oh yeah, yeah. So what kind of two remedies that I mix it in the case of the fear of health and fear of and get hot easily?
Okay, I would give arsenicum album first, but again, you have to see the pattern or improvement. You have to wait for at least a month.
Yes,
And
yes.
then you have to see if what is the next remedy showing up.
Okay,
Okay. So, but
okay.
these are mostly the remedies used for fear.
And the use for fear, what the dose you start with, like
Okay. Again,
200?
no, again,
See?
for what you're asking me is levels of health. You have to see
Oh yeah,
what level of health is that person is. What group? Group A is not, mostly they're not, but it is group B or group C. So for group B or group C, mostly what we do is we cannot give very high. Remember, I gave you a chart
yes,
of what is the most proper remedy for a certain group. 30 to 200
yes,
don't go very high, right? I'll share that
yes,
chart with you guys.
share it. Could
Yeah.
you share this too? Could you share
Yes,
this
yes,
tablet
I will. I
here?
will. I will share this
Okay.
also. So when you have something that you are not very, very sure, give one remedy, wait and watch. Just like I showed, that's why I showed you how those that Dr. Banerjee is treating the patients and how that Dadaji, another monk, is treating the patients. They're sitting there giving one remedy and then the patients are coming back in a month and then they're seeing if the patient is better or worse or the same. That's what we see in the follow up, and then they treat them accordingly or they wait. Okay. And then
Okay.
some patients who don't want to wait anything, but also I believe giving in tissue salts, because we can
Oh,
afford tissue salts in those clinics. Maybe those patients don't afford tissue salts and that's why they are, I don't know why, I don't want to put what I think or what I don't think. Let me keep my thinking to myself. They are doing what they feel is the right thing to do and it's working very well for them. For me, when I started my school and when I was a student of homeopathy, and now even now I start my patients on a remedy, and then in order for me to wait and watch and the patient getting apprehensive that I'm not taking any remedy, I give them tissue salts, and tissue salts also help them with the mineral deficiencies and with the deficiency of all these important tissue salts, and it covers that. Plus, I tell them to get a better nutrition.
yes, yes.
Okay, so are we all good?
Yeah,
Okay.
I like it. Thank
Anyone
you so
else
much.
has any
Yes,
question?
Barakallah feek.